This topical suspension is used to help treat acne and other skin conditions like seborrheic dermatitis and rosacea. It contains an antibacterial agent and a drying agent that promotes shedding of the top layer of skin, keratolysis. When using this medication, it's important to follow the directions from your doctor or on the product label. Typically, it's applied to the affected area once or twice a day, or as directed by your healthcare provider. It's best to use it at the same time each day to help you remember. Make sure to wash your hands before and after applying the medication, and avoid getting it in your eyes, nose, or mouth. If you have any questions or concerns about using Sulfacleanse 8-4 suspension, topical, be sure to talk to your healthcare provider for more information. When using Sulfacleanse 8-4 suspension, topical, it's important to apply it only on the skin. Before using this product, make sure to clean off any makeup, oil, and excess dirt from your face with a gentle cleanser. If you are using the liquid form, shake the bottle well before each use. For the liquid cleanser product, apply a generous layer of medication as directed by your doctor, usually once or twice daily. Gently massage it into the affected skin for 10 to 20 seconds until a full lather forms, rinse thoroughly and pat dry. If using the cleansing cloth product, wash the affected areas with a cleansing cloth as directed by your doctor, usually once or twice daily. First, wet your face with water, then wet the cloth with a little water and work into a full lather. Cleanse your face with the cloth for 10 to 20 seconds. Do not get the lather into your eyes. Rinse thoroughly and pat dry. If excessive drying occurs, you may need to rinse the cleanser off sooner or use it less often. Avoid getting any of this medication in the eyes, on the lips, or inside the nose or mouth. And make sure to consult your doctor or pharmacist for further details. If your condition does not improve or worsens, it's important to inform your doctor. If you experience redness, irritation, or scaling of the skin, it's important to consult your doctor. It's also important to note that many people using this medication do not have serious side effects. However, you should immediately inform your doctor if you experience cracked skin, unusual weakness or fatigue, dark urine, yellowing eyes or skin, signs of infection, easy bruising or bleeding, or aching/swollen joints. Additionally, if you notice any symptoms of a serious allergic reaction such as rash, itching, swelling, dizziness, or trouble breathing, seek medical help right away. It's important to consult your doctor for details if you are using this medication on raw or broken skin, as you may be at an increased risk for side effects. And as always, if you notice any other effects not listed above, don't hesitate to contact your doctor or pharmacist for guidance. Before using Sulfacleanse 8-4 suspension, topical, make sure to let your doctor or pharmacist know if you are allergic to sulfa or sulfur, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have kidney disease. If you are planning to have surgery, it's important to let your doctor or dentist know about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Sulfacleanse 8-4 suspension, topical should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it's important to consult your doctor before using this medication if you are breastfeeding, as it may pass into breast milk. It's important to be aware that Sulfacleanse 8-4 suspension, topical may interact with other medications and potentially increase the risk of side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. Additionally, be cautious of using skin products containing silver, such as silver sulfadiazine, as they may interact with Sulfacleanse 8-4 suspension, topical. Always consult with your healthcare provider before using any new products in conjunction with this medication. If someone has taken too much Sulfacleanse 8-4 suspension, topical and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. For Canadian residents, contact a provincial poison control center. Remember that this medication can be harmful if swallowed. It's important to remember not to share Sulfacleanse 8-4 suspension, topical with others. This medication is prescribed specifically for your condition, and it may not be suitable for others. Sharing medications can lead to harmful effects and is not recommended. Always use this medication as directed by your healthcare provider and do not give it to anyone else. If you forget to take a dose of Sulfacleanse 8-4 suspension, topical, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. It's important to store Sulfacleanse 8-4 suspension, topical at room temperature and to keep it away from children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.